Welcome to Project First Line. Thank you for joining us. Today, we'll discuss the concept of risk recognition and how you can apply it to help prevent infections in healthcare. Throughout this training and in all other Project First Line infection control training modules, the term germ refers to bacteria, fungi, or viruses that are likely to pose challenges to infection prevention and control. Thinking about the question of what risk is and how you recognize it, can you recall an instance at work or home when you identified a risk and took action to stop something bad from happening? How did you know it was a risk? Had you seen it happen before, or was it something you were taught? Feel free to note a few examples in your participant booklet. Upon reflection, we recognize risk all the time in our daily lives and take proactive measures to prevent bad things from happening, like intervening when a toddler tries to climb up on a table, or slowing your car when you see a dog on the side of the street. You do the same at work and healthcare, no matter your role. Whether it's mopping up a spill on the floor, checking medication dosages, or stepping in to help a patient avoid a fall when they are unsteady on their feet, these are all examples of recognizing risk and taking steps to minimize it. Risk recognition means seeing the potential for a problem to happen, but seeing it doesn't mean it has to happen. Earlier, you recounted situations where you identified a potential problem and took proactive measures to prevent it from becoming a real problem. And that's important because it emphasizes the significance of your actions. You not only identify risks, but also take decisive steps to address them. In other words, you recognize risk and you act on it. Now, let's watch a brief clip illustrating these concepts in practice.
You deal with risks every day at work. Think about times when you're mopping up a spill, checking a medicine dose, or when you see a wobbly patient about to fall. You see a possible problem that could hurt a patient, and you take action. You can use this same process of recognizing risk when it comes to infection control in healthcare. If you learn to spot the opportunities for germs to spread, then you can step in and take action to stop the spread of germs. So why are we so focused on germs in healthcare? The risk for germs to spread is different than it is at home and in the community. There's a higher chance for germs to spread in healthcare settings than, for example, a grocery store, because it's where patients who are sick come for care, and patients who are already weak or ill are likely to be more vulnerable to infection. Healthcare is also unique because some of the things healthcare workers do as part of giving care can put patients at risk of infection, like starting an IV. Sometimes we are the opportunities for germs to spread. We interact with a lot of people throughout the day. We touch a lot of things and we use many different kinds of equipment, and these are all ways we can spread germs. All of this is why we have to think about infection control in healthcare differently than we think about infection control in the community.
The concepts of recognizing risk when we're at work in healthcare, like seeing the potential for a patient to fall down and stepping in to help, also apply to infection control. When there's a risk for germs to spread, you do certain things, like clean your hands before giving a patient an injection, put on PPE before doing certain tasks, and clean and disinfect high-touch surfaces like door handles and light switches. Thinking further about the idea of recognizing risk, can you think of times at work when you recognized the risk for germs to spread? What have you done to stop germs from spreading before they caused problems? When we think about germs spreading in healthcare, it's helpful to remember what makes healthcare a unique setting with unique challenges and risks for infection control. We think about germs and their risks differently in healthcare than in other places like at home or in the community. Why? Patients are coming in for care, so there's a higher chance that they have an infection. Because many patients are ill and weak, they're likely to be more vulnerable to infection, so the risks from germs spreading to them are higher. And sometimes the things that we do as part of giving care can actually put people at risk of infection. If a patient needs an IV, their skin has to be broken. If there are germs on their skin or the needle, inserting the IV can introduce germs into their body. And finally, the work that we do in healthcare brings opportunities for germs to spread. We usually have closer interactions with patients during care than people have in the community. We interact with many people and we touch and share a lot of things and equipment throughout the day, which are all opportunities for germs to be spread. That's why infection control is different in healthcare than in other places, and why it's all the more important to recognize the risks for germs to spread throughout your workday. These factors increase the risk of germs spreading in healthcare and are why infection control actions in healthcare are so important for keeping opportunities for germ spread from becoming reality. As a healthcare worker, you can recognize common situations and risks and know what to do about them, which means you can protect your patients, your colleagues, and yourself. We've talked about recognizing risk in general and about higher risks for germ spreading in healthcare. Now, let's work together to identify and discuss some potential infection risks in the following images depicting common healthcare scenarios. Examine each picture and identify the risks associated with the spread of germs. You can jot your ideas down in your participant booklet. This person looks like a patient, and they look like they don't feel very good. What risks do you see for germs to spread? Possible risks include the patient appears to have a respiratory virus that could spread by respiratory droplets, even though they are masked. Germs could spread from the patient to surfaces in the waiting room. The patient could touch surfaces in the waiting room that have germs on them and spread those germs to themselves when they wipe their eyes or blow their nose. Let's look at another photo. What risks do you see here? Possible risks include germs could be spread from the patient's wound to surfaces in the waiting room. Germs from surfaces in the waiting room could reach the patient through their wound. There's no patient in this scene, but is there an infection risk? Possible risks include the overflowing sharps container, the uncapped needle sitting on top of the trash is a risk. Someone could get stuck with it and germs on the needle could get into their body. A sharp in a regular trash can instead of a sharps container. An overflowing trash can, which is an infection risk if it contains items like used tissues or other items carrying germs. The supplies placed near the sink, which could get splashed with water that contains germs. We've covered a substantial amount of information today, so let's take a moment to revisit some key highlights from today's training. Risk recognition is seeing the potential for a problem to happen. You see risk every day at home and at work, and you take steps to minimize it. You can help control infections in healthcare by learning to recognize the risk for germs to spread and cause infection and take steps to prevent it from happening. Healthcare is a unique setting. We consider germs differently in healthcare than we do in other places, like at home or in the community. The work that we do in healthcare presents many opportunities for germs to spread. Everyone, no matter their training or role, can recognize an infection risk and take action to keep germs from spreading. Thank you for your time and attention today. I hope that you can take these ideas and apply them at work. Even though we covered a lot today, there is still much more to learn. You can keep exploring these topics on your own using the resources in this module. Project FirstLine has a suite of products to help you learn more about how to recognize infection risks at work, where germs live in healthcare, and how germs spread. You can also follow Project FirstLine on social media.